is asking, how can doctors in the UK best offer their help and support to the health system in Syria, and how do they get involved? So I'm going to address this first to Salah ad-Din and then to our colleagues from Hand in Hand. So Salah ad-Din, you've already started to touch on how you became involved in your contributions, but what would you say to the wider Syrian and non-Syrian diaspora in the UK?
I think just get involved, and people will appreciate much more than your medical knowledge and clinical skills. I think recently we're in a course with David Nutt Foundation of war surgery in medical school in Aleppo University, and either because I wasn't particularly great trainer or because truly people felt the way we come across as a British doctors as being approachable and down to earth. That's really what most sort of element of our behavior, not only myself and colleagues, Pep, Litchworth and the entire team. So I think by you being there, genuinely you help to develop the system. So, I mean, I want to be a bit controversial, and again, because I'm a free person, I'm not aligned to organization, I can be, probably you can't. I mean, I think, let's face it, who are the ministers currently in Syria? Prior to this, it's a mix between those who run the health system in Idlib, which is much smaller, with different politics and different ambition. And also, they inherently have a lot of what we lived through the Assad's regime, from Hafiz Assad and right through. I mean, when I first got involved in Idlib, I felt we had a chance to change things fundamentally, but then I realized that was probably a big ask. I'm actually just asking the same now for the entire Syria. Start afresh. Otherwise, you're just going to continue as it was for the last 50 years with a slightly different color. And I think really now we have opportunity from doctors inside Syria and not Syrians and Syrians outside to get to work together and make this radical move, jump, don't walk, just to jump. This health system in Syria is disastrous. Let's face it, it's just disaster. When you compare it to Britain, when you compare it to the United States, we're too far away. And there's no point of making a slow movement. You really need to appreciate where you need to be. Just decide first what good looks like and work toward it. Don't start from thinking what I have and what I can afford, because really you can't afford more than what you have. So our role as Syrians who left Syria many years ago is actually to help our colleagues, to show them what is good, what good looks like, and help them to achieve it.
Well, and thank you very much, Salah ad-Din. And I think you're very much an example of someone who's provided phenomenal support. But also Muhammad is an example of a healthcare professional who could easily have left Syria and Turkey, but has provided phenomenal and long-term support to Hand in Hand, but also Syria more broadly.